All right. Well, thank you so much for having me here. And I'm really excited to talk about the state of the virus of coronavirus in the US. And I don't actually, when I think about it, I'm not sure I'm excited to talk about it because the response in the US is going so incredibly badly. And I want to talk a little bit about why that is, how it is that we have gotten here, and what we can do to make things better. So the first case of the virus hit the US around January 20th, about the same time that South Korea saw its first case. And we could not think of two countries that have gone in more different directions. Where South Korea initially took the virus very seriously, built up an entire testing, tracing, and isolation program, and has generally managed to keep the virus suppressed. The US approach was really about denial. And in many ways, it remains about denial. So for much of January, February into early March, the big discussion was there even any virus here? Do we even need testing? And by mid-March, it became very, very clear in the US that we were having large outbreaks in New York, in New Orleans, in other parts of the country as well. And when the hospital started getting full and the number of people started dying really spiked, we essentially went into a national shutdown. But even that was incredibly variable across states. So one of the things that's a feature of the United States is that it often doesn't act like one country. It acts like 50 different countries, each representing a state. And especially under this president who has really tried to let states make their own decisions, all the states did this differently. So even though we had a national shutdown, the bottom line is many states didn't actually end up closing so much. We went all the way into April and May. Cases in New York and elsewhere came down. The government put out guidance of what would make it safe for states to open up. And about half the states in the country ignored all of that guidance. And around Memorial Day, the last week of May, states started opening up again. During this time, our testing capacity in the US went from close to zero to better. We were able to test 100 or 200,000 people a day. But for a country of 330 million people, that's not necessarily fantastic. Late May, what we saw was many states opening up without declining case numbers. No policies around wearing masks. And they opened up very aggressively. They opened up all the bars and restaurants, and Arizona opened up nightclubs. And really what we have now is a tale of two countries. About half to two-thirds of the states are seeing increases in cases, some of them very, very dramatically. And about a third of the states are continuing to see declines in cases or very, very low, flat level of cases. And it's interesting to think about why that is. I think a lot of it is really driven by perceptions among a large proportion of the American populace that this virus is trivial, that it's no worse than the flu, that it doesn't really harm people, that all the deaths that we saw in New York, they weren't even real, that maybe they were manufactured or maybe, and that misinformation campaign, I think has one of the things that has made America so different, is that large parts of the country, 20, 30% of the population largely believes that this virus is not particularly lethal, not very serious, and this whole thing is overplayed. Those are people often located in certain states, often under certain types of political leaders. Though what I think is important is that majority of Americans do understand that this is a serious virus. Majority of Americans have taken the concerns very seriously. I would say there are two or three really critical things we want to be looking at. One is that we are generating about 50,000 or so new cases per day. That's what we're identifying through our testing, though much of the data says that we're still probably missing 70, 80% of cases out there. So that might mean that we may have 200,000 or 300,000 new cases a day happening in the United States. That's obviously very, very substantial. The second is that mortality rates have been relatively flat, which has made some people wonder, has the virus changed? Has it become less lethal? And I have sort of two or three thoughts on this. One is we've seen a big shift in the disease from older people to young people, which of course will make the disease less lethal because we know young people are more likely to survive. Second is that we are getting better at therapies. We're getting better at treating the disease, and so even the same patient will do better. And then the third is that death is always a lagging indicator. And so what we're seeing right now in Texas and Florida and Arizona is hospitals getting pretty full and a lot of people hospitalized. What I expect, unfortunately, to see as July rolls along into August is the number of deaths beginning to really increase. And I suspect that's coming in the days and weeks ahead. Fundamentally, I think for America, we are at a very critical crossroad. We have to decide as a country, and we may not decide as a country, and I'll come back to this, but we have to make a decision as a country. Are we going to take the virus seriously? Are we going to try to suppress the levels of the virus? Or are we just going to try to learn to live with 50, 70,000 new cases a day, 1,000 people maybe dying every day? And of course, I have a very strong preference, which is I think we need to take the virus seriously and we have to suppress it. So if we were to do that, what would that look like? I believe we need a national law or mandate on wearing masks in public. Second is, I think in this moment, things like nightclubs and indoor bars and maybe even indoor restaurants may just not be tenable. And third is we've got to push more on testing and tracing and isolation as one of the key strategies. Now, this is not some magical list. This is literally the same list that countries around the world have employed. What I suspect is likely to happen in the United States is we are going to see multiple different responses to the pandemic, just as we have so far. So I suspect there may be a dozen or so states that do quite a good job and will look as good as any European country or even better in terms of all of these things: masks, social distancing, testing and tracing, keeping virus levels down, having reasonably good economic activity, maybe even being able to open schools and run schools. I worry that for large parts of the country, the politics of mandating masks, the politics of contact tracing may be such that it'll be very, very hard to do those things. So as we look on to the future, I suspect we're going to see an America where some parts of it look like Western Europe or even East Asia in terms of excellent control, and other parts that look like Brazil or Russia or other places that are just struggling to keep the virus at bay and keep their economies open.
So Ashish, would you be able to explain how would we approach the public, which is sometimes feels a little clueless with all the misinformation, disinformation, and pseudoscience and true science. And it's so hard these days to tell what's true and what's not, what's a conspiracy and what's not, what is science and what is not. So what advice would you give people when they see all the deluge of information flowing in? How can they deal with it? How can one make sense and decide for his own personal family, his own factory, his own business, what to do next? What would your advice be?
Yeah, so clear and consistent communication is always a challenge, especially when you're facing a deluge of misinformation from others. So the question is, why should people believe scientists over their friend's Facebook page? It's always, again, it's a difficult situation. I think one of the things that we are learning is while the message is important, the messenger is as well. And so in many communities, I've been advocating for partnership with faith-based organizations, with synagogues and churches and other religious institutions, so that those are trusted people in those communities. And if they hear the same message from their local rabbi or their local priest that they're hearing from the scientific community, that alignment helps counter the misinformation. But it's very challenging. And of course, there are many of us who are pressing companies like Facebook to do a much better job, because they have become the spreader of misinformation in a way that has made it very challenging for those of us in public health to just share facts and data and the truth with the American people or with people around the world.
So, Ashish, if you had to give 3 last pieces of advice to the decision makers out there watching us in what to do next in view of the coming summer wave and winter challenges, what would those be?
Yeah, so the 3 pieces of advice I would give. First is, don't ever believe that there is a difference between controlling the virus and opening up the economy. Often people see these two things as at odds with each other. The best way to open the economy is to suppress the virus. The best economic policy is a great public health policy. We've seen that over and over and over again in country after country. People have made this mistake, and eventually they've ended up with both terrible public health and a wrecked economy. So that's kind of number one. Number two is time is on our side, meaning the more we can suppress the virus and the longer we can go without large outbreaks, therapies are getting better. We're getting closer to a vaccine. Diagnostics is getting better. So often people say, well, if a lot of people are going to get sick, why don't I just go ahead and get infected now? And the reason is because we're already much better at treating this disease than we were 3 months ago. I am confident we're going to be that much better 6 months from now than we are today. So if you have to get the virus, better to wait. And of course, we're going to move towards getting a vaccine, hopefully sometime in 2021. So that's number two. And number three, if you're a political leader or a business leader, the most important thing you can be doing is communicating clearly with clear expectations. We're still early in this pandemic. We are not almost done. The virus is not behind us. Setting realistic expectations for people is incredibly helpful in helping them make smarter decisions, for letting businesses make better decisions, for letting governments make better decisions. One of the problems I've seen over and over again is too many people just want this behind us. Actually, we all want it behind us. But just because we want it behind us doesn't mean it is behind us. Being realistic about what's ahead of us is critical if we're going to get a hold of this virus and manage it effectively.